Many students who go on to work in the field of health communication end up performing roles that we might understand to be interpersonal forms of health communication. And when we talk about interpersonal health communication, we're talking about advising or otherwise consulting on patient-provider communications, perhaps providing some of those workshop sessions where they speak to doctors about how to most effectively treat patients using the right communication methodologies. Secondly, we might think about ways that various different members of the health communication field go on to do community dialogue and perhaps lead advocacy campaigns or public health and safety campaigns as spokespersons or representatives or the media creators and representatives of those various different organizations. Third, we might also think about some individuals in health communication who go on to perform the role of counselors in various different industries and fields, both counseling experts and leaders in the concept of consulting, but also actually counseling individuals who might be going through grief or dealing with a very difficult terminal illness. Finally, we also see a number of health communication careers in the field of personal selling. When we talk about the context of personal selling, of course we're talking about some things like medical sales equipment. There's a large expanding field of careers in medical sales equipment, but we're also talking about things like going door to door to doctors' offices, if you will, and talking about things like pharmaceutical sales. Those careers are of course lucrative and aplenty. So if we're looking to improve health communication, and we've identified a few reasons why we should, we might seek to find places in which we could improve that health communication, and in the context of our upcoming assignment, you might think about places where campaigns are assembled around these various different focus points. And so the first place we might obviously see health communication is between the doctor and the patient. But it's also between the patient and their families, and the way that they speak about their own medical conditions. The process of self-disclosure is an often studied phenomenon in communication, and so the choices that individuals make as they release their diagnosis and discuss the information about how their life will change with their parents and with their family is certainly an important point of consideration. This interest in health communication and the relationship between patient and provider and between their patient and their families and friends extends to an interest in the way that communities understand public health. Certainly, we've recently come through a public health epidemic with an understanding of the corona pandemic and the coronavirus. This brings to deep attention our understanding of the need for public health campaigns and the effectiveness of health campaigns focused around things like wearing masks or washing your hands. And so in this instance, we also see health communication as an important space that functions between citizens and communities, and between medical experts and representatives of the medical community, and those others that they affect, including the public, doctors, and the various different disciplines of medical organizations. So if we think about things that communication scholars are well trained to be able to help medical professionals with, we might observe some of the key dynamics of interpersonal behavior and acknowledge some of the skills and training we've had in identifying those fundamental important qualities. The first thing we might note is that healthcare providers should be increasingly trained to identify the distinction between signs and symbols. Rhetoricians and scholars of discourse and communication have long described the difference between symbols and signs to note that signs are involuntary behaviors. In the context of something like a sneeze, that is a sign you might have an allergy. You can't control that, and so doctors have long recognized signs. But perhaps less attuned are symbols. And when we think about what a symbol is, symbols are voluntary acts of expression. Now, different cultures have different symbols, and different individuals come to accrue different symbolic meaning. It's increasingly important that those in the medical professional community are able to identify these different symbolic forms of expression so that they can better treat patients. For some, pain isn't very easily expressed, and so there might be less symbolic expression of pain. For others, however, pain is worn on the sleeve, if you will, and so it's important for doctors to observe the ways that individuals might express their pain so that they can better remedy and treat those individuals. Additionally, we might note that the medical community as a whole, and certainly healthcare providers, should have an increased knowledge of cultural diversity. As the United States and the world around us become increasingly networked and dense, it's especially important that we think about the role that diversity has in providing effective and ethical healthcare treatment. One thing to note is that there's differences in the way that families are socialized to share their diagnoses, and so as we relate back to those concepts related to community dialogue, it might be important that we think about the way that certain individuals are predisposed to self-disclosing or sharing their medical information, and others are less likely to do so. That concept often comes from family socialization. Additionally, we might note that there's considerable variability in the ways that power and social status are perceived by various different cultural groups and forms, and oftentimes times doctors' lab coats and the various stethoscopes they wear into the offices can be pretty intimidating for individuals who don't often go to the doctors or don't often know a lot about the medical community. And so in this regard, doctors might think about the way that they try to lower those barriers of entry and communicate in ways that reduce that hierarchical structure. These are just a few of the dynamics of interpersonal behavior that communication scientists have been studying for decades, and that could certainly apply fruitfully to the medical profession and field. The hope is, with improved interpersonal communication, patients would have improved relationships with their doctors, and it wouldn't just be in terms of higher satisfaction scores or Yelp reviews for the doctor's offices, but it would be in lasting outcomes for those patients in terms of better health efficacy, longer lifespans. If you choose to focus on a public health campaign, you might think about the way that that public health campaign makes various different cross-cultural appeals. As you think about a public health campaign like the CDC's Wash Your Hands campaign, they certainly have to release that information in multiple different languages and across multiple different communities, some who, as we've described in the political unit, might be sympathetic, otherwise supportive of the message, some who might be neutral or unaware of the message, and some who might be downright opposed or even hostile to the message. And so as groups like the Center for Disease Control and other public organizations try to come together to promote health campaigns, we might ask how they do that across various different cultures. In thinking about cross-cultural health communication, we're thinking about the way that public health is affected by all social determinants of the entire community, and we're emphasizing the importance to consider the various different stakeholders who are involved in our community dialogues related to public health, and all of those who are involved in the effects of our public health decisions and outcomes.